Hi, I'm Arsha Vahabzadeh at CES 2019 at the Digital Health Summit studio, and I'm here with Steve Van, an extraordinary patient advocate, and we're going to talk a little bit about patient-generated health data. Wonderful to have you, Steve.
Well, thank you. Thank you for having me here today.
I know that you're passionate about patient-generated health data, and you've really got some personal perspectives on it. So what does it mean to you?
What it means to me is that I own my health now. I get an opportunity through patient-generated health data to be able to capture my data on a daily, ongoing basis, take that data, and be able to share that data with my healthcare team and healthcare provider. That way, they have an opportunity to see my whole movie reel, not just the snapshot that I used to do. I used to walk into the office, have a blood test, and they would take a snapshot of my health. Now, they capture my continuous glucose monitor. I'm able to share my blood sugar, the entire readings for the day, my blood pressure on a regular basis. And through that, I've been able to make some behavioral changes and a lot of health changes as a result.
So it sounds like capturing that quantitative data has been very useful, but sometimes you have multiple people involved in your care. How does that data work to kind of glue together the team or integrate your care?
Well, I was very fortunate to work with a team named Validic that actually took all of my data and put it into the healthcare provider's system. When they did that, my doctor was able to go to those, I called it the big cloud in the sky. From the patient point of view, I was just sending them the data. But he was able to look at the data and then share that data back with me. And one of the most positive parts about it from a patient point of view is that normally they take things from you. They take your blood, they take your x-ray, but you never really get anything back. What this did is it gave me an opportunity to get something back. We began to really talk in detail about my glucose and what drove my glucose. Just a real quick story. Absolutely. I went through the process on a regular basis, captured my blood sugar, and sent it to them. I go see my care team, we sit down and we go over all the data, right? We sat there, go through all the data. My care team said, well, Steve, what are you doing every day around 8 or 9 o'clock? And I said, look, I'm being good, really. You know, my kids are gone to college. Had an opportunity to sit down with my wife and finally own the TV and watch Netflix and what we want to watch. And you know, we popped some popcorn, and then when she looked at me, she said, you popped some popcorn. I said, yeah, well, popcorn's healthy, isn't it? I don't put any butter on it. I don't have the salt on it. She said, Steve, popcorn is glucose. That's going to raise your blood sugar. That's what's been raising your blood sugar every day at 8 or 9 o'clock at night. And I said, my aha moment, aha. I was able to see what was affecting my behavior through the data that I was giving my care team. With that, I could then change my behavior. I could not make those choices. I could make better choices. But for us as patients, what often happens, we don't know what choices to make. I mean, we think we're eating healthy, but do we know we're eating healthy? With that feedback with our care team, they can provide guidance. If not, it's all noise. You know, it's just noise to us to go there, figure out, okay, you're type 2 diabetic. Go ahead and eat.
So it sounds like the data, capturing this quantitative data, not only is leading to insights to your care team and integrating care, but it's also giving you insights at home because you're able to see the numbers, you're able to see the data for yourself and modify and adapt your behavior as you see it.
You know, behavior change, I think, is a big driver, right? But how do you get there, right? You know, early on, I said, I get to own my health. I don't give it to them anymore. We're a team.
Well, it's very encouraging to see how that data is driving this bi-directional conversation instead of a monologue, as you were saying.
Right, and as a result, I took my A1C from 8.6, 8.7, all the way down to 6.7. That's a 2-point change.
That's an incredible change.
Yeah. So I mean, but that's with communication.
Steve. It's been really phenomenal to hear about your personal story and the progress that you've made capturing this patient-generated data.
All right. Thank you very much.
Wonderful. Thank you. I'm Arsha Vahabzadeh at CES 2019, reporting from the Digital Health Summit studio, sponsored by Living in Digital Times. Thank you.